Hello everyone. So today here in this video, let's discuss about the topic diabetes mellitus. So diabetes mellitus is a metabolic disease in which the body's inability to produce enough insulin, resulting in abnormal metabolism of carbohydrates and elevated level of glucose in the blood. So before getting into the topic, let's discuss about insulin. So food is broken down by our digestive system into nutrient molecules that then absorbed through digestive tract and used by our body. So food containing carbohydrates and sugars are broken down into glucose. So glucose is an important source of fuel for many organs in our body. So however, to use glucose, the glucose molecules it should first enter the cells. So the pancreas produce a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. So as the blood glucose level rise after a meal, insulin is released into the bloodstream and set a process to trigger the removal of glucose from the blood to enter into the cell. So when this process gets disturbed, it causes a disease called diabetes. So let types of diabetes. So there are three types of diabetes mellitus: type 1 or insulin dependent diabetes mellitus, type 2 or non-insulin dependent diabetes mellitus, and gestational diabetes. Symptoms of diabetes. So the common symptoms of diabetes includes polyphagia, which is nothing but increased sensation of hunger, and polydipsia, excessive thirst, polyuria, which is nothing but excessive urination, unusual weight loss, fatigue, blurred vision, in women, frequent vaginal infection, and in men and women, yeast infection, dry mouth, and slow healing wounds of cut. Let's see in detail about type 1 diabetes. So it is also known as juvenile diabetes. It is usually diagnosed in children and young adult. So it is an autoimmune disorder where the body's own immune system destroys the insulin producing cells of pancreas. So here in this video you can able to differentiate the healthy and type 1 diabetes where the autoimmune reaction is taking place, where the autoimmune system is destroying our beta cells of Langerhans. So that is a reason why insulin production is getting disturbed. So this is a reason for type 1 diabetes. Type 2 diabetes. So type 2 diabetes is the most common form of diabetes. About 90% of cases are undergoing this type of diabetes. So this type is used to be called as adult onset or non-insulin dependent diabetes. It can develop at any age. Most common, it can be prevented. So in this case, in this type of diabetes, body cannot use insulin properly. So body produce insulin, but it does not use it properly. So glucose doesn't move into the cell, they just pile up in the bloodstream itself. So this is a reason for this type 2 diabetes. We human beings need glucose for our body energy. So we get glucose when our body breaks down the carbohydrates that we eat or drink. Through that, glucose released into our bloodstream. As I said earlier, insulin regulates the glucose level. So if you doesn't have diabetes, the pancreas senses and releases the insulin in a right amount so that the glucose level will be maintained in our bloodstream and it can enter into the cells. But if we have diabetes, this system doesn't work. So in type 1 diabetes, due to autoimmune response, the insulin deficiency leads to increased glucose in blood. And in type 2, it is bit different. Insulin production will be there, but insulin will not be effective. So in both types of diabetes, because glucose can't get into the cell, it begins to build up or it begins to pile up in the bloodstream itself, which causes diabetes. So next we have gestational diabetes mellitus. So gestational diabetes mellitus is nothing but getting diabetes during the gestational period, which is nothing but a pregnancy period. So having gestational diabetes put you at risk for diabetes type 2. It's more or less similar to type 2 diabetes. So 18 out of every 100 pregnant females will develop gestational diabetes mellitus. So high blood glucose level in mother, gestational mother, brings extra glucose to baby. It causes baby to put on extra weight. Uncontrolled diabetes may lead to these complications, which includes blindness, damage in the blood vessel in retina, which causes blindness, kidney disease, nerve damage, cardiovascular disease, stroke, heart attack, loss of circulation in arms and legs. So, due to the improper circulation in the arms or leg, or it may lead to necrosis. And as I said earlier, in diabetic patient, the wound will not get healed so fast. So wound in food that won't heal leads to amputation. Amputation is nothing but a loss or a removal of a body part. It may be finger, toe, hand, or so on. So these are the complications of diabetes. So how to monitor diabetes? Random blood sugar we can able to monitor by glucometer in our home itself, so that we can able to maintain a logbook, or we can able to keep a record, so that we can able to track a blood glucose level easily. So these are all the normal ranges, where normal ranges from 70 to 100 in fasting blood sugar, and in postprandial 70 to 140 mg, and pre-diabetes shows the result between 101 to 125 mg per dl, and in postprandial 141 to 200, and in severe diabetes case it is 125 mg per dl, and 200 mg per dl and above in postprandial. So along with this, we can also take HbA1c, which where the HbA1c shows you a average diabetic value of 3 months. Preventions of diabetes mellitus. In the case of type 1 diabetes mellitus, it is not preventable as of right now, because it is an autoimmune disorder, and we can maintain and control the sugar level by insulin injection, and we can have a healthy lifestyle like doing a proper exercise and having a good diet. In the case of type 2 diabetes, primarily we can maintain a healthy lifestyle, and then we can check HbA1c and adjust the diet. As I told you earlier, HbA1c shows you a average result of past 3 months. So by keeping this reading, this value, we can adjust the diet and we can maintain the glucose level. And tertiarily, we can do exercise and have a proper diet. So gestational diabetes. So in the case of gestational diabetes, we can prevent this diabetes by physical activity. So researchers found being physically active before and after the pregnancy reduces the risk of gestational diabetic mellitus by about 70% or more. So we can also have a proper diet. A study showed that each 10-gram increase in fiber a day reduces the risk of gestational diabetic mellitus.